Hello, my name is Russell King, and this is my critical assignment presentation for CHIN 505, Ethics and Leadership in Kinesiology. Okay, so um, my chosen profession is physical therapy, and depending on where the physical therapist works, their duties can be slightly different because they could be different if they work in a nursing home compared to a hospital. They would have different um, responsibilities, but there are some responsibilities that are the same across the board. The main thing is that they are trying to help their patients get back to a normal life after they have some kind of sickness or injury or something like that, so that they can just be able to be back with their loved ones. If they're in a nursing home or something, doing rehab, something sort of like that. The physical therapists work with doctors and nurses to uh, develop treatments to, um, like I said, just help the patient get back to a normal lifestyle. They also supervise physical therapy assistants, which is uh, just someone there to, like the title suggests, just assist the physical therapist in whatever they might need. The physical therapists use the medical history and the patient's goals to develop the treatment to so that they can get back to what they're wanting to do, whether it be just getting back to work or it could be um, just whatever they need to do. Um, they also work with the patients and their families when the patient does get released. They work with them to like post treatment care, whether that be having in-home visits or what have you. So I would have to say that my go-to strategy for leadership is transformational leadership. And they the transformational leader uh, like not only leads their followers but also pushes their followers to become leaders themselves. So I believe that is a good thing to do because I believe that a leader should not ask some their followers to do something that they're not willing to do. I've had some really horrible leaders that they not only like micromanage everything that they do, but they also delegate their responsibilities to others. So they're getting by on the work of others, and that's not really good idea. I've had some managers where they not only ask their followers to do something, but also occasionally they come down and they actually help their followers with the tasks that they ask them to do. Which I the followers of those leaders, they have so much more respect for their managers or leaders, whatever you want to call them. Because honestly, the the managers are willing to get down in the dirt with their followers, and in my opinion, that is really cool to do. Uh, so I have some things that I would like to incorporate in if I'm able to get into physical therapy. I was wanting to incorporate some martial arts in with the treatment. This is a good idea because it has a number of uh, valuable aspects to your health and also to your psychology because um, it 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 um, helps with balance and strength, coordination, all of these things, which are very important when you're trying to get back into a normal lifestyle. You want to focus on these things. It also helps with your endurance, so that's a really good thing too. Not only does it help with the health, the physical side of it, it also helps with the psychological aspects too. Because although it's a way to defend yourself, it actually um, decreases the amount of um, aggression towards others. It also helps with stress levels because you're able to get your stress out on focusing on like form fighting or in sparring even with the proper pads. Um, I think it's also a good idea to get to know your patients because if you get to know your patients, you're able to empathize with them and you can come alongside them and encourage them to meet their goals and whether to be, you know, in better physical shape or whether it be just to get back to their family and to be able to do things that they haven't done in a long time. It's also important to recognize if the patient has any religious or spiritual needs. It's good to incorporate those into your treatments because that gives them a personalized treatment, not just here do this exercise or do that exercise. There are a couple of aspects where it can be an ethical dilemma, and if done, the first one that I came up with was if you the prescribed treatment that you come up with, if that actually ends up causing more harm than good, um, that's not a really good thing. These it could be the treatment causing harm than good. It could actually be from either an overlooked by the physical therapist, and which that is a big no-no and should not be done. It also it could be like a injury or something that the doctors even missed. So if this happens, then you need to go back and reformulate uh, your treatment plan. Also, I noticed that when I came across my research, there were some that physical therapists actually got accused of uh, sexual assault while treating their uh, patients. Um, I mean, this is a really easy thing to avoid, but apparently it happens more often. The number one thing is like never be alone with your patient, like whether it be one of your physical assistants, physical therapy assistants, or just um, another associate. Just never be alone with your patient. And also if you're touching your patients, make sure you use gloves if you haven't touched their skin. That way, there's still a barrier between your hands or what have you and the patient's skin. Also, just make sure that you explain what you're doing and get the patient's consent to do what you're about to do because that, that's one of the things that I saw that kept coming up is there was a misunderstanding and then the physical therapist got accused of sexual assault and that's not a good thing. So in conclusion, I just you know what some physical therapy and what physical therapy entails and why martial arts can be useful a useful tool in your treatment because like I said uh, it ends up focusing on like balance and endurance and strength and flexibility, all the things which are really good when trying to treat somebody for physical and physical therapy. It's also a good thing to. You also know why it's a good good thing to get to know your patients. That way you can celebrate with them when they meet their goals, and just to get to know them and encourage them to continue on with the treatment. Also, some easy easy way to avoid ethical dilemmas. Um, it just it's a no-brainer if you're gonna just act with integrity, and the ethical dilemmas should take care of themselves. The following slides are just all the references that I have for my presentation. So I would just like to thank you for your time and have a good day. Thank you.